I have been a meth addict since I was probably 29 years old. I'm 54 now. I didn't like myself, so I didn't care about me. I had to get put into jail to be able to get recovered because I wasn't doing it on my own.
When people come for services out of Cato, they're very unsure. They're not really necessarily sure that they want treatment. They're scared. They don't have life skills. They're not sure what to expect. They get in there, we start working with them, they start to feel comfortable with us. First thing off, we're saying avoid using people, places, and things. That's their world. It's our job to help them to feel comfortable so that they feel that they can trust us and really openly talk about things that are going on and follow through with some of the recommendations that we do make. We can have reduced crime rates. We can have reduced deaths from overdoses. We can have reunification of families. It's huge to be able to provide those services to the people in Ashley County.
It took the village to help me, and I'm so grateful to have had that opportunity. I couldn't have done it without you guys.
My older son died by suicide. I was frantic to try to find somebody that had been through this and is still surviving and even could laugh now and then. One of the sad statistics is those of us that have lost somebody to suicide are very high on the list of also dying by suicide. This topic is such a taboo topic for so many people, and those of us that have lived through it feel very, very isolated until we find somebody that has gone through it, and then it's like we're kindred spirits, and it's like, talk to me, listen to me, talk to me. The support group provides a place for you to express all of your feelings and all of your emotions. Sometimes we don't even talk about the suicide. Sometimes we talk about everything, because when you've lost somebody by suicide, it weaves itself into your life in so many different areas.
Ashland Mental Health and Recovery Board offers several things. They offer a suicide awareness walk. They offer QPR training. They offer a crisis text line, and they offer a suicide griever support group. A lot of people think that if you question somebody about whether they're having thoughts of suicide, that's going to push them over the edge. We want to train other people out in the community, teachers, neighbors, potential mentors. Ashland is now prepared for anybody who has lost a loved one through suicide with the community support, with these people who have already gone through the loss. Unfortunately, they've gone through the loss. However, they can now come alongside somebody else and say, I'm sorry you're here, but we're glad you found us.
If anybody that is watching this, if you've lost somebody by suicide, or you have a friend that has lost somebody by suicide, there is help, hope, and healing. And what you can do is call the Mental Health and Recovery Board and ask for the time and the place.
I think families and individuals come to the program, and most programs in general, because they don't want to be alone. They need help, they want socialization. There are lots of reasons that drive people. You learn to support people, you learn to care about people, and sometimes kids don't get that. They have adults maybe that aren't reliable. And so when this person says, I'm gonna do something, they're gonna do it. And that kid is different because somebody did what they said they were gonna do. And that changes things, that gives them trust, that gives them hope, and I think this provides us the opportunity to do that.
Families should participate in the services, and seniors, because it is a win-win situation for them. They have a place where their child can do homework after school and is taken care of. They get a snack, they get to play games and interact with a safe adult. And the youth get the benefit of just being with someone that cares for them. I feel like with this program, we can impact the community, we can impact the youth and the seniors, and make a difference in Ashland County.
The School Liaison Program has three main goals that we focus on. And so we want to improve attendance and help improve their academics and lessen behavior problems in the classroom or at home for that matter. So we don't just focus at school, we also focus in the home. We have one family that came from Mansfield City, which is a much bigger district than Hillsdale. They were homeless, living in a camper in our district, just making sure that the kids have breakfast and lunch, and then checking with the family to see, okay, what does dinner look like for your family? Getting them to school, one less thing the parents have to worry about as they're trying to figure out where they're going to live next, where they're going to get a job at. For families that don't have access to the school liaison program, I would worry about children having to worry about adult problems and not being able to just be a kid and go to school, kind of falling through the cracks. I would hope the community realizes that together, the old saying is it takes a village to raise a child, and for me it takes our community to raise a child. It's about relationships, and if I can make a difference in the life of any child, I consider that an honor. And I want them to know that they're better than they could ever imagine.